Hey YouTube, Jam and Eggs coming to you today. Thank you for rocking with me. I hope you are having a blessed and productive day. So, as the title states, this video is about what type of nurse you would like to be. Maybe what even type of nurse that you are striving to be. Whatever the case may be, this video is for. All right. So, I want to say this video is a conversation based on something my coworker and I were talking about. Now, I just got off of work. As you can see, I'm still in my scrubs. I have a little stuff on my sleeves, whatever. I'm about to go to sleep. I work night shift. So night shift is a little bit more relaxed. A lot less people there. It's calm down, everybody sleep. You should have a chill night. However, like the saying goes, it can be lit at the night show. I'm not even playing. Because a lot of people are not there, you do have to do a little extra mileage. Like, for example, if the residents or the attending physicians are not in cahoots together, that could be difficult. So, the attending physicians, they go home. You have residents. Residents sometimes don't feel confident enough to do certain orders, so they're like, oh, just skip that and just do that in the morning. Tell the medical team in the morning. Then you also have a lot of rapid responses. You have codes, so like code blues. You have all type of codes yelled across the intercom, and some of the codes can be, a person being aggressive, it's a fight, some type of trauma, because I work at a trauma hospital. So anyway, with all that being said and done, it's a lot going on all at once. And I'm saying all that because even though you have a lot going on, number one thing that you have learned in nursing school is that you have to prioritize. But also, you have to be a team player. Like the saying goes, there is not an I in team. Team. So, I want to base this conversation on that. So, like I said, I was having this conversation with one of my coworkers because we were talking about somebody else. And I just wanted to touch bases on that because I know I personally have been practicing nursing for the past 3 years. So yes, I'm a newbie, but I have learned a lot. Like just in my professional behavior and also in my personal behavior, I have learned tremendously. So I just wanted to spread, like I said, a little knowledge to you. So something that I had to learn and something that you're going to have to learn is that you're going to have to check your attitude at the door. Professionalism is key, and I tell you, no matter where I have worked at, because I started from the bottom and I worked my way up. So I started from being a nursing assistant to I did home health aid, I did phlebotomy, and then I was a LPN, so a licensed practical nurse, and now I'm an RN. And I'm trying to work my way up to nurse practitioner. So anyway, with all that being said and done, I have realized that I had to check my personality, my demeanor at that door. Now, don't get me wrong. You're not going to disrespect me, but I had to most definitely learn when to cut it on and off. So, but I'm one of those. Excuse my Frenches. I am one of those professional bitches. So, if you want to take it there, I can get very technical. I can pull out policy, and I want to let you know, just because I might be younger than some of these seasoned nurses, and also just because I might be younger or less knowledgeable in the nursing field than compared to some people, you're not going to still come from my neck. So, I just want to let you all know there's a, an equal balance, but you're going to have to learn how to tame that tongue and be professional. So you don't want somebody to come at you sideways, so don't you come sideways at somebody else. Two, like I said, teamwork makes the dream work. Whenever there, like I said, there's some type of codes or some type of rapid responses, regardless if the person is not your patient, they want to get on the bed pain, they want to go on the bedside commode, if they simply want to walk down the hallway, ask that nurse who is covering for that patient to see if you can help out, if that's okay. If their IV pump is going off, it could be a very important medication, i.e., like a heparin drip. We get a lot of that where some nurses don't pay attention that this stuff drains on out. So if a pump is going off and you hear it, you're sitting outside the room or you're standing outside the room, go check on it. You never do know what you might walk into and what you might see. Okay? Now, thirdly, when you're getting report, please, when you first get in there, come on time or come a little earlier, because especially somebody like me on night shift, I'm tired, I'm ready to go to sleep. My body naturally, like everybody else, wants to go to sleep at night. So it's a little bit harder for night shift people. They want to go home and sleep. So come a little bit on time. Sorry, that's my dog. So come a little bit on time, well, a little bit on early side. So therefore, you can look up the patient, you can go do your rounds, see how they're looking, and then give report. And do not take forever trying to be on the computer and trying to see every little detail about the patient. You have all your shift to do that. I mean, get the basics of what's going on with them, but if you want to get the detail, the nitty of the gritty, okay, unless you and that nurse is okay with doing that, but sometimes some of these reports don't need to be like 30 minutes long. That's ridiculous. So yeah, do that. But also be ready, which is number 4, ready to give your report. Like, don't try to, still be scrambling unless it was some type of emergency. If you had all day or all night to do whatever you had to do, why are you sitting here waiting? I should not be looking at the clock or hunting you down to get report. All right. Number 5. Please do your assessments in the computer and physically do your assessments. You want to make sure that you are a nurse that is knowledgeable of most definitely the patient, but of their disease process. You just don't want to be like, I don't know. I don't know. I'm not going to lie, there are some times where I'm just like, I truly, honestly don't know. However, I can find out, or we can both look in the computer together about something, but something that might not make sense to somebody, one nurse can pick it up, or you can be like, oh, well, I didn't think about that. Let me go ahead and, jump on that. But, again, that goes back to you being a team player. So yeah, just please, please, please be knowledgeable. Number 6, treat others how you would like to be treated. That goes for both the people on your team that you're working with, but also that goes for, most importantly, your patients and their family members. You don't know how many times I have seen people who have ignored the call bell, how many times people have gotten an argument with the patient and it didn't even have to be there, or how many times the patient had fell, all because of the simple fact they got tired and they wanted to get up and clean themselves up because they either pooped or peed on themselves. So avoid catastrophes by just basically getting up and see what this person needs. Regardless if they keep blowing that call bell up all night or all day, see what your patient needs, because some of these people, they need special attention. They're going through something, and just because they're going through something does not necessarily mean that you have every right to ignore them. So that goes back to, number 1, check your attitude at the door. You're really going to have to understand that this is not all about you, and you need to be professional at all times. So do that. Answer them call bells. Ding. All right, number 7. You need to make sure that you are properly medicating and that you most definitely are medicating on time. I've seen so many people going back to situations with the call bell where they're like, oh, I need some pain medication. Medicate your patients. It's not that hard. I'm telling you, once you medicate your patients, especially with pain, they will be A-okay. So, again, Treat your patients how you want to be treated. Always put yourself in their situation like, this would be my mom, my father, my aunt, my uncle, my brother, my sister, hell, even my grandparents. This one day will be me. So keep that into consideration in your mind. Like, hey, let me make sure that I'm up to par with this stuff. So think about that. That's something to really sit on. Number 8, always continue your education. Do not stay stagnant. Again, if you don't know something, look it up. Get a mentor. Try to most definitely expand your horizon. I've seen so many people that I work with right now. This is have been their first and only job. I mean, first and only. Straight out of college and have not continued near bit of education. They take little classes here and there that they have to take at work, but when I tell you they're not taking no advanced life support stuff, like my unit right now, we don't have to do the PALS, which is that pediatric advanced life support. But for me personally, I want to take PALS. And somebody might be like, I don't understand why you need to do that. You don't work on a unit where you be working with children. Hi, I'm a nurse. You never do know when you might be out here in the street and you need to do something. Or better yet, I might switch and have another opportunity. I'd rather have that opportunity available. And it's free because my job gives it to me free. And then also, if I have that opportunity to do it, that's even better on my resume. Think about that, how that expands your horizon. So do not stay stagnant. Always be in suit of greatness. You want to strive for greatness. Don't be ignorant. Number 9. Please do not abuse your charge nurse. I don't understand how so many people do not know how to effectively intervene in nursing. They will go to somebody and they will pick. Oh, can you start this IV? Oh, can you go talk to this family member? Oh, can you go talk to this patient? Oh, I'm not doing that. Oh, this tech did this. Or, oh, this nursing assistant did that. I need you to do this. Like, this charge nurse have so many other responsibilities. They're there, yes, to sometimes problem solve, but some of the most minute things, if you can do it on your own, problem solve yourself. Like, you have RN behind your badge. And like I said, some of these people have continued education. Why are you abusing your charge nurse? Stop it. Just think, this is going to be you that's going to be charged maybe tomorrow, maybe even next week. You don't want nobody to abuse you. So stop trying to play these charge nurses out. Okay? Okay. Lastly, number 10. This is something that is dear to my heart. And this is something that's just my personality. But I think it also changes. It could change a person, and it could really be near and dear to somebody else as well. But look at your patient as a person and not a disease, not a disorder. A lot of times people disconnect themselves from people and they don't understand how to have just a friendly conversation or even tell a little bit about themselves. My nickname is Nurse Sunshine. That might not be hard for you to understand why. I am a very positive person. I'm optimistic. I love to just have little conversations with the patient and make sure my patients are okay. Get to know them, because sometimes you learn information out just by default by just having a regular conversation with somebody, and then you're able to pass that on to the next nurse. Or you can be giving a report to the same nurse, just to update, and they're like, oh, how did you find that out? Because I talked with the patient. So yeah, just talk with your patient. Make sure you checking them out. You know, mental health is a big thing that we are neglecting, and we need to make sure that our patient is not just being taken care of physically but mentally. So you got to think about that. And you know, this might not just be therapy for them, you just talking to them, but it might be therapy for you. So don't be selfish, and just always reevaluate a situation and know that no matter what you're going through, it could be worse. That could be you in the bed. So a little conversation goes a long way. So, like I said, these are just some tips that could help you be a better nurse. And most definitely, I just really want you all to be the best that you can be. I am daily learning new different things about myself. I am learning to have better conflict resolution. I'm learning how to tame my tongue, and I pray before I say certain things. So that's just me, but I just want you all in my nursing community to find that niche, find out who you are, and be better than that person you're complaining about that you work with, and they're always that negative Nancy, always complaining, and they're always saying that they can't do this. Be better than that. Be a nurse that you strive to be, that you have closed your eyes and dream about. Be him or her. Nothing can stop you. You are your own competition. You are your own critic. And you are your own nurse. Your patient. Nobody can take that from you. You have those credentials because you worked hard for it. So, I hope that you like this video. Please, if you have any comments, leave them. Like the video, subscribe, and if you want to follow me on any of my social media, I will link that below, and I will also have my email if you want some help or you just want to talk. Let me know. I hope to hear from you all soon. Nurses rock. Peace and blessings.